Access to healthcare is a constitutional right for all citizens, but for people with special needs, receiving healthcare can be close to impossible. Albert Mofokeng is deaf. He questions why government departments do not have sign language interpreters, even though sign language is an official language in South Africa. He says communicating with doctors or nurses in healthcare facilities is a nightmare.
First of all, when you go to the hospitals, communication is a problem. Secondly, when a deaf person is sick and the doctor tries to communicate, he does not understand the symptoms. So there is no sign language interpreter. I just wish the health department can help us because the doctor depends a lot. The same goes for nurses. There should be a sign language interpreter at health facilities to make it easy to access for deaf people because it's difficult and there are lots of barriers.
Organizations such as Autism South Africa and the Embrace Diversity movement highlighted challenges that people living with autism and the LGBTQI+ community face when visiting healthcare facilities.
They are misunderstood most of the time because of their sensory problems. So it gives them challenges in order to be helped, because sometimes you find that they are very sensitive towards whatever that's going to be used on them, like maybe needles and all the equipment. Sometimes you find that they are not able to communicate with the nurses and all that, and all the professional workers because of the learning barriers that the language barriers that they have.
Embrace Diversity movement is looking at the interest of the LGBTQI in general, and when it comes to issues of interest, we're talking about education, whereby we need to educate and sensitize people about issues around LGBTQI, how are LGBTQI forming part of the communities at large. You know, there are services that we are advocating for. When you go to the SABC, when you go to clinic facilities, whereby you need health services, those are the issues of interest.
The Social Development Department in Lejweleputswa advises anyone who falls victim of gender-based violence to use its Tutuzela centers that are one-stop facilities.
It's very important that people know that we have Tutuzela care centers. That's where they can go and get assistance. Social workers are there, forensic nurses are there. Remember, some of these things people don't know about them, that there are centers around the district where they can go. From Tutuzela care center, that's where the case will then be opened, but also if there's a need for a person to be sheltered, because it's a secret space where whether it's a woman or a man, including their children, we also do take them as Department of Social Development, and social workers work with them to assist them to go back to their so-called normal life.
The Lejweleputswa District municipality says it has recorded worrying levels of gender-based violence recently.
But I want to see us working together, going out in communities, because everybody that is here is on the communities. So I want as a district to make sure that we go to communities and make sure that we reach out and talk to our people, because you will find out in the boardrooms we have all these things, but outside there is not, information is not there. So I want us to spread the news. How is it that we can help our people?
The health department says pooling of resources will aid it to implement strategies under the district development model.
On the other hand, is to ensure that we bring all stakeholders and role players in health together, because as the Department of Health on our own will not be able to can achieve the health priorities that we need to achieve. So for us, it's also assisting in taking forward the district development model, which means that we can then pull together the resources of the state and those of our partners in order to achieve a healthier and a well-Free State community.
The 3-day summit will end on Friday. Kamogelo Siekwi, SABC News, Welkom.